Rita, licensed marriage and family therapist, and welcome back to Fun Fact Friday. Last week, I reviewed some general information in regards to anxiety disorders, but this week I actually want to go more into details with a specific anxiety disorder, which is panic disorder. Occasional anxiety is a very typical and normal part of life. We typically need anxiety in order to face our fears, in order to get ready for a test, meet our deadlines, we perform a little better than we would typically perform. However, anxiety disorders and panic disorders more specifically involve more than just temporary worry and fear. A person with a panic disorder experiences anxiety that doesn't go away and can get worse over time. These individuals can experience panic attacks that interfere with school performance, job performance, relationships, and other aspects of their lives. So what is a panic attack? Panic attacks are sudden and repeated attacks of intense fear. It usually includes heart pounding, maybe palpitations, or an accelerated heart rate. It may even include trembling and some sweaty palms, sensations of shortness of breath, smothering, and or feelings of choking that may feel very uncomfortable for the person experiencing it because they have this sense of impending doom. Typically, with a panic disorder, you have the sensation of being completely out of control when you're experiencing a panic attack. They experience intense worry about when the next panic attack will happen, and they typically fear and avoid places where panic attacks previously occurred and will go out of their way to completely avoid these situations. Some people live very restricted lives because of these panic attacks, where they can't even go grocery shopping, they can't go out in public, they can't even leave the house. Panic attacks are very unexpected, and some of the times they may even be experienced during sleep. About 1/3 of people that experience a panic disorder that live these restricted lives will go on to develop what is called agoraphobia. Agoraphobia is when your fears keep you from getting out into the world because you feel that you might get trapped or you might not be able to get help. For example, people with agoraphobia tend to worry when they are in public transportation, such as buses, ships, planes, etc. They may worry about large open spaces, such as parking lots and bridges. They may worry about enclosed spaces as well, such as movie theaters or stores. They may even worry about being outside their home. So just imagine being incapable of leaving your own home. The National Institute of Mental Health states that agoraphobia is very rare. Less than 1% of the American population has agoraphobia. However, women are twice and even 3 times more likely to experience agoraphobia, and it is seen most commonly in young adults and teenagers. Since a panic disorder has very similar symptoms to any sort of heart, breathing, or even stomach issues, it is very important to go to your medical doctor to rule out any sort of medical conditions. But if you've gone to your doctor and your doctor has not found any sort of medical condition, maybe it's time to seek psychotherapy. Consider it. If you would like more information on psychotherapy, feel free to contact us here at www.peninsulafamilies.com. Thanks for stopping by this week's Fun Fact Friday. Stay tuned for next week, where I'll be debunking a myth related to social anxiety disorder. See you then.